In the fight against COVID-19, Johnson & Johnson just released new information about a potential booster. So the company released data saying a second shot 2 months after the first dose makes its vaccine 94% effective against symptomatic COVID-19. That data also shows that it boosted antibody levels fourfold. However, if the shot was given 6 months after the original instead of 2, it was even more effective. Of course, the FDA and the CDC still need to pore over this data. The J&J shot originally, you remember, was intended to be a one-and-done deal. Now this news of a booster, which isn't really terribly surprising if you've been closely following all along over the last several months. But to help me break it all down for you, I'm joined by Dr. Todd Ellerin, an infectious disease specialist at South Shore Health. Good morning. Good to see you.
Good morning, Sonia.
Okay, so let's start off with what does this new data really tell us about the difference between 1 dose versus 2 doses of this J&J COVID-19 vaccine?
Right. So, I don't think it's surprising, but when you give that second dose, that booster, you get more effectiveness in preventing infections, and it looks very good against preventing hospitalizations, and you still maintain excellent results against that severe infection and death, which even the single dose does very well. So, I think overall what we're seeing is that you give another dose and overall it raises your antibody levels. So you're really preventing against infection and symptoms.
Okay, I'm going to nerd out here for a second with you, Dr. Ellerin. Are we just looking at antibody levels? Some people say that's not the only measurement of success that we need to be looking at.
Right. Well, what we did see, as you outlined before, was that if you give that second dose, you get a much higher antibody level, about 4 times. That's at the 2-month interval. If you boost at that 6-month interval or after that, you actually get a 12-fold increase in antibodies. But that's not the only thing. The clinical trial, the Ensemble 2, showed that overall global effectiveness was 75% with that booster. But as you pointed out, in the United States, it was actually 94%, probably because we have a little bit less variance in the U.S. than in some of the other countries that were studied. And when you look at severe and critical cases, there were none, which means really 100% against protecting against the most severe illness. So the second, that booster really does help.
So this new data is coming out from the company this morning, right? But what are the next steps in terms of the process? What do the FDA and the CDC now do with this data?
Right, so the FDA and the CDC have a lot to think about, because what they have to decide is, okay, Johnson & Janssen is giving us this information. Number one, they have to review it to make sure it's accurate. And then next they have to say, well, how are we going to frame this? In other words, are they going to recommend that Johnson & Johnson now become a 2-dose vaccine for everyone? Are they going to say maybe it's going to be 2 doses for the more vulnerable, over 65, comorbidities, similar to what we heard before about the 3rd dose for the mRNA vaccines? Maybe that will come into play. So it remains to be seen. I do believe ultimately that they will be authorizing and then recommending the second dose, at least for those more vulnerable groups. But it remains to be seen.
Okay, so for the folks sitting there watching and they're listening to you and they're thinking, okay, well, I got this J&J COVID-19 vaccine. What should I do now? What would you say to them?
Right. So at this point, remember, this needs to go through the FDA and the CDC. So wouldn't rush to do anything yet. And fortunately, winter is not here when we're really going to need the protection the most. But sooner than later, we're going to get guidance both from the FDA and the CDC to figure that out. But what I would say is, especially if you're in one of those more vulnerable groups, the booster recommendation is likely coming now. Will it be recommended that those that are young and healthy get a second dose of the J&J vaccine? Not necessarily. And remember, there is a warning for younger women, especially with that rare vaccine-induced bleeding and clotting in the brain. So again, that's rare, and I'm not trying to scare anyone, but that's really why we have an FDA and the CDC to scrutinize, to really look at the risks and benefits. There's no question, for the most vulnerable people, we're going to get a green light on the second dose of the J&J vaccine. But for the young, healthy people, the general population, we really have to wait to see what the experts say about that.
Yeah, I'm glad you made that distinction, an important one. Certainly a lot of watching and waiting right now. Dr. Todd Ellerin, thank you so much for your time and insight today.
You bet.